My name is Dr. Uday Kumar Maya, and I am a medical director of this organization called OTI Medical. I am a practicing oncologist and I look after all the medical operations of OTI Medical. Diabetes is an illness which is asymptomatic initially, and the symptoms develop only if one develops a complication associated with diabetes. Therefore, it's important for us to maintain the symptom-free period as long as possible and prevent or postpone the various complications associated with diabetes. One of the major complications one can have with diabetes are end organ damage. Therefore, maintaining a good glucose level throughout is of paramount importance. Now, how do we maintain good glycemic levels? In an established diabetic, the best way to monitor sugar levels is to keep a check of the A1C reading. A1C reading between 6.5 to 7 or below that is considered as good diabetic control, and these people will have very less chances of developing diabetes associated complications. By corollary, anybody who has a very unstable A1C reading which shuttles between 6 and 9 or 6 and 10 are having a high probability of developing various complications. Now, what are these complications I am talking about? The most common area where a diabetic has to watch out is cardiac problems. Diabetics are more prone to develop heart attacks, angina attacks, and various cardiac associated peripheral vascular disease. Therefore, by maintaining a very constant glycemic level, by having periodic cardiac checkups, by having ECGs done periodically, one ensures that the cardiac complications are either not occurring or occurring at a later date. The next common problem are the eye problems. Diabetes are prone to a condition called diabetic retinopathy, wherein they will slowly start getting blind because the retina is damaged by the uncontrolled diabetes or progressive diabetes. So, visiting an ophthalmologist to have a very good retinal checkup is of paramount importance. We should also note that diabetics have a more higher propensity of developing cataracts compared to the general population. The next organ in question which can be at risk is the kidneys. Kidneys can get what is called end-stage diabetic renal disease, which will end up with dialysis and renal failure. So the best thing for us to do is constantly keep a monitor on kidney functions, especially one element called urinary microalbumin. A close monitoring of urinary microalbumin is an indicator of the trouble to come in future or good kidney health, depending on what the range of that particular reading is. The next organ to be affected are the skin and the soft tissues. Diabetes, because of the inherent nature of the illness, develop less sensitivity of the feet because of peripheral neuropathy, and without their knowledge tend to hurt their feet and develop what is called diabetic foot. And because of the increased glycemic levels, infections are very rampant in this particular foot, and if not careful, they may land up with amputation of that particular foot or finger in question. So to keep all this in question, please remember, keep your glycemic levels in good control, do good exercise, have a balanced and good diet, and visit your specialist whenever the doctor asks you to do.